بسم الله الرحمن. احنا هنتكلم عن migrational disorders of the brain. Viral abnormalities, agyri, pachygyria, polymicroviri, schizencephaly, green matter heterotopia, unilateral megalencephaly. And we talk about its manifestation in ultrasound, in fetal ultrasound, how to see it in the fetal brain during ultrasound. Schizencephaly is an uncommon CNS congenital disorder of neuronal migration, characterized abnormal cleft by brain. The cleft can be localized anywhere in the brain, but they usually localized in the perisylvian regions. Schizencephaly. As we see in this coronal scan and the axial scan, the typical features of bilateral schizencephaly: cleft in the brain, especially in perisylvian regions. This is schizencephaly being open or closed. Closed of communicating with ventricular system, closed of not communicating with ventricular system. Open communicating with ventricular. As we see, this cleft, unilateral cleft present in the brain, in the cortex, schizencephaly. Unilaterals. This is communicating with ventricular system, open type. This is bilateral schizencephaly. Lissencephaly is characterized by agyri accompanied or not by pachygyria, minimal or no ventriculomegaly, and the characteristic dysmorphic features. Lissencephaly may be isolated or agyri, or accompanied or not by pachygyria, secondary. Minimal or no ventriculomegaly may be associated with them, characteristic dysmorphic features. Lissencephaly, the surface of the brain unusually smooth. Agyri, for a fetus at 28 weeks gestation, the sylvian fossa is shallow. There is no sign of cingulate gyrus and precentral gyrus. The texture of the cortex is more irregular and echogenic than usual. Lissencephaly, agyri. بنحس ان surface of the brain ممسوح. No gyri features as we know it normally. Lissencephaly in this fetus at 29 weeks and في mild ventriculomegaly. As we see in these parasagittal planes, في enlarged ventricle and lack of normal sulcations. This parasagittal plane. في periventricular heterotopia in 21 weeks fetus with agenesis of corpus callosum, and this is can في irregular ventricular wall with heterotopic nodule. Irregular heterotopic nodule, as we see this nodule protruding into lateral ventricle. Heterotopia. We see in these images parasagittal plane show normal sulcation of the posterior portion of the parietal lobe and abnormal sulcation in the anterior portion. This is anterior portion frontal lobe في agyri, posterior portion parietal lobe في normal presentation. We line the demarcation between these two zones. These different images of Lissencephaly. Somatoform dysplasia in this fetus at 23 weeks. As we see in coronal planes, abnormal bilateral, abnormal over developed sulci and gyri in occipital lobes. Lissencephaly at this 26 weeks between pregnancy, hypoplastic left hand syndrome, microcephaly, transabdominal parasagittal plane, so thin and irregular cortex surrounded by increased amount of cerebrospinal fluid, as we see in these images. Frontal lobe bilateral schizencephaly at 25 weeks because of the mild ventriculomegaly, and we see few communication between lateral ventricle and subarachnoid space. This communication between lateral ventricle and subarachnoid space. This coronal scan shows the typical features of Lissencephaly: agyri, pachygyria, second gyri, عكس Lissencephaly at 34 weeks. This fetus with postnatal confirmation of congenital syphilis notes the presence of ventriculomegaly and slightly echogenic irregular periventricular white matter. Slightly echogenic irregular periventricular. Cerebro-oculomuscular syndrome, Lissencephaly type 2. This is Lissencephaly type. Cerebro-oculomuscular syndrome with encephalocele, Lissencephaly type 2. Unilateral megalencephaly, the unilateral sided overgrowth of the cerebral hemisphere. Hamartomatous overgrowth. Overgrowth of one hemisphere which appear brightly echogenic with a lateral ventricle irregularly enlarged. Brightly echogenic with lateral ventricle irregularly enlarged, as we see in these sites. This is Ultrasonic. Porencephaly includes every type of destructive lesion with cavitary character. Fluid-filled spaces within the brain that commonly communicates with the ventricles. Subauricular space. This is porencephalic cyst. This is congenital cyst, as we see. Reconstruction strategy. Porencephalic cyst. CSF. This is CSF collections, as we see. Porencephalic cyst. Sagittal scan show typical features of porencephalic cyst communicating with ventricular system. Syntelencephaly, as we see in this axial sonogram, with anterior to the rear left 16 weeks fetus with the midline interhemispheric fusion variant of holobryssencephaly, show absence of cavum septum ballosum with a poorly defined fluid collection in the midline. This is monoventricle, but with interhemispheric separation of the frontal lobes. Note the anterior falcus, which excludes classic holobryssencephaly. As we see in this fetal autopsy, coronal MR show abnormal midline connection, gyral continuity of the cerebral hemispheres in the posterior frontal and parietal regions, not also paired and fused thalami. Syntelencephaly. Arnold Chiari malformation في 4 type Lissencephaly. Type 1 tonsillar herniation through foramen magnum plus normal force ventricle present in adult. ومعها 70% stringomyelia, 5% bony dysplasia. Type 2 presents in neonates and infant, accompanied by lumbar myelomeningocele, caudal herniation of tonsils, medulla firmis. Hydrocephalus may be due to associated aqueduct stenosis or occlusion of ambient system. Associated with hypoplasia of corpus callosum, falcus deformed midbrain. Type 3 major deformities with cerebellar hypoplasia. Type 4 accompanied with high cervical or occipital encephalocele. Arnold Chiari. As you see, this is normal. This is cerebellum and tonsils. This is Arnold Chiari, downward displacement of cerebellum torsional. This herniations, which is causing cisterna magna obliterations. As we see, this is sagittal T1 images of the brain. Chiari 2 malformations, as we see MRI fetus congenital anomalies. Chiari 2 malformations seen in 95% of myelomeningocele. Abnormalities include caudal displacement of cerebellum, bones, and the medulla. Cerebellum, bones, and the medulla. Fourth ventricle elongated, posterior fossa small, peaking of tectum, cisterna magna obliterated. These axial images show fetal head or banana-shaped signs, banana-shaped cerebellum, and the effacement of cisterna magna. The cisterna magna effaced, and the banana-shaped cerebellum. This is sagittal images of the fetal muscular region show myelomeningocele. Arnold Chiari malformation with banana sign and syringomyelocele at 14 weeks gestations. Arnold Chiari malformation, and this is axial. As we see in this Arnold Chiari malformation, lemon signs and absent cisterna magna. Lemon signs and the banana signs of cerebellum, lemon signs of frontal lobe, of frontal bones, ventriculomegaly. This is myelomeningocele, as we see. Lemon sign and ventriculomegaly are 13 weeks gestations. What's the mean? Transabdominal ultrasound show the fetal head show bilateral frontal indentations. I see by this arrow, and ventriculomegaly, as evidenced by dangling of choroid plexus and the convexity of the lateral wall of the ventricles, as we see. This is ventriculomegaly and lemon sign, bilateral skull indentation and just anterior to insula due to collapse of the anterior calfarium seen prior to 24 weeks, and so on. This is image seen in open neural tube defect. This appear in later gestation. Lemon sign in Chiari 2 malformations, indentation of frontal lobe of the skull في associated ventricle. Banana sign of cerebellum, obliteration of cisterna magna in the Chiari 2 malformation. Cerebellum is elongated and wraps around cerebral peduncle. banana sign of the cerebellum, obturation of cisterna magna, as we see in Arnold Chiari, 2 malformations. Coronal sign, sagittal image show typical features of vein of Galen malformations. Septo-optic dysplasia, from its name, septo, septum pellucidum, optic chiasma, atrophy, septal pellucidum agenesis, septo-optic dysplasia. Septo-optic dysplasia, rare congenital disorder, characterized by absence of side walls of the cavum septum pellucidum, hypoplasia of the optic nerves and chiasm, leading to alterations in visual acuity, various types of hypothalamic pituitary dysfunctions, as in diabetes insipidus, alteration in the levels of hormones, association with developmental and intellectual impairment. Rare brain abnormality, septo-optic dysplasia, incidence 2 to 3 per 100 in general population. It can be isolated or part of septo-optic dysplasia, whole Lissencephaly, agenesis of corpus callosum, and malformations of cortical development. Second, disruption of septum pellucidum due to severe hydrocephaly, etiology most likely multifactorial. This is corpus callosum, normal corpus callosum. This is septo-optic dysplasia, agenesis of septum pellucidum. And we see fused frontal horn, agenesis of septum pellucidum. And this is normal. Sonographic appearance of coronal view, absence of septum pellucidum resulting in squared appearance of the frontal horn. Squared appearance of the frontal horns with inferior pointing, as we see by this arrow. This is lobar whole Lissencephaly, this septo-optic dysplasia, this is normal. Sonographic appearance of absence of septum pellucidum, septo-optic dysplasia. Sonographic appearance differentiation between septo-optic dysplasia and isolated agenesis of septum pellucidum is hard. One may try to use maternal urine and serum estrogen levels, fetal blood is safe for growth hormone and ACTH prolactin, visualization of the optic nerve size at the third trimester by MRI, looking for optic nerve hypoplasia. Septo-optic dysplasia, chiasmae, on optic chiasma atrophy, dysplasia, hypoplasia, as we see in coronal MRI. Septo-optic dysplasia, 3D ultrasound, as we see. Septo-optic dysplasia, visualization of fetal optic chiasma and some 3-dimensional ultrasound, optic chiasma hypoplasia. Septo-optic dysplasia, axial sonogram anterior to the left 29 weeks denotes absence of normal pokes of the cavum septum pellucidum between frontal horns of the lateral ventricle. Frontal horn of the lateral ventricle communicate at midline, and the postnatal MRI show absence of cavum septum pellucidum and confirmed clinically by ophthalmological examination. This is diagnosis. Tuberous sclerosis in the fetus, second trimester. Firstly, echogenic mass in the left ventricle of the heart, consistent with rhabdomyoma. Another 2 mm low signal intensity, as you see subependymal region, subependymal nodules in tuberous sclerosis. Low signal intensity nodule, as we see, similar to that periventricular. Low signal nodules in location similar to seen. High signal intensity nodules in location similar to seen in others. This is subependymal nodules seen in tuberous sclerosis, differentiated from heterotopia and other subependymal nodules. Hyperechoic brain mass. Hyperechoic brain mass seen in the fetal brain, fetal ultrasound. Hemorrhage, teratoma, lipoma of corpus callosum, intracranial calcification. Types of intracranial hemorrhage soon after the hemorrhage. Blood diffusely echogenic, and this is grade 1, grade 2 hemorrhage. Old hemorrhage. Coronal scan demonstrates typical blood clot and ventricular enlargement. Grade 3 hemorrhage. Grade 4 hemorrhage. That arrow indicate intraventricular blood clot. Arrowhead tractive region in the periventricular cortex. This is grade 2, grade 3, grade 4. Different presentation to blood hemorrhage, blood degradation products in the intraventricular hemorrhage. As we see in this image, this is blood clot, intraventricular hemorrhage, blood clot, and we see reconstruction images. 3-day-old boy with mild hypoxic ischemic injury Here, sonogram show brain swelling with hyperechogenic subcortical white matter and increased gray-white matter differentiation. Meckel-Gerber syndrome at 12 weeks gestation. Encephalocele, the fetal hand, post-axial polyductile, echogenic kidneys, urinary bladder not visible. Meckel-Gerber syndrome. Echogenic kidneys and urinary bladder not visible. Fetal head show post-axial polyductile, encephalocele. This is Meckel-Gerber syndrome. Torch infection, Toxoplasmosis, rubella, Cytomegalovirus, herpes. Viral infection, first you talk about virus. Ultrasound at 13 weeks and 2 days. Estimated fetal weight, ventriculomegaly, posterior horn of the fetal cerebral ventricle 1.4, periventricular hyperechogenic foci. This is cases. Intracranial calcification may be accompanied by ventriculomegaly, polyhydramnios and fluid index, fetal ascites and all non-immune hydropes, normal blood flow in arterial umbilicals. This is presentation of case of Cytomegalovirus infection at 13 weeks. Fetal cerebral ventriculomegaly at 13 weeks and 2 days. Ultrasound seen at 36 weeks and 3 days. Intrauterine IUGR and fetal cerebral lateral ventricles 1.7 cm. Amniotic fluid index 28, reduced diastolic blood flow in the umbilical artery 1.78. This is pulsatility index. In ICU, newborn palate with petechial rash, multiple deformities and abnormal palate and arthroperiposis, movements absent, consciousness disorders, insufficient hemodynamics, ultrasound followed hydrocephaly, blood at PCR, cytomegalovirus positive. In the ICU, X-ray show arthroskeletal arthrogryposis. This cases of cytomegalovirus infection. Congenital cytomegalovirus, cytomegalic inclusion disease. Clinical finding variable: hepatosplenomegaly, jaundice, thrombocytopenia with purpura, chororetinitis, cerebral calcification, microcephaly, hydrocephaly, and this is cerebral calcification images with ultrasound. Brain find with fetal cytomegalovirus infections. Periventricular echogenic halo similar to that described for periventricular leukomalacia, mild ventriculomegaly, irregular choroid plexus. More severe cases, echogenicities within the cortex are associated with excessive size of subarachnoid space suggesting microcephaly. Parasagittal transvaginal sonogram with a fetal brain 25 weeks show abnormal periventricular hyperechogenicity and intraventricular adhesions, as we see by this head of arrow. Parasagittal sonogram with this brain at 22 weeks show abnormal periventricular echogenicity with cystic formations and striated arterial vasculopathy, as we see arrowhead. Observe presence of ventriculomegaly. When these images show large cisterna magna and fourth ventricle and hypoplastic firmness, this brain, as we see with cytomegalovirus infection. We see parasagittal, this is 37 weeks, show periventricular tissue protruding through undefined ependyma, periventricular tissue. In sagittal brain, we show periventricular cyst protruding into a large lateral ventricles, periventricular cyst. This is parasagittal at 31 weeks show abnormal undeveloped pre and post central gyrus and calcification, gyri and calcifications, as we see. This transvaginal sonogram show at 29 weeks gestation show parenchymal foci of increased echogenicity. Parenchymal foci increased echogenicity consistent with calcifications and abnormal sulcation with this open arrow. With sagittal sonogram, we show hypoplastic pleurid corpus callosum and the genome of corpus callosum not observed. The splenium is seen and this indicates cavum septum pellucidum. With this image, we show cerebellar echogenic foci. This is cytomegalovirus. First trimester cytomegalovirus infection, 28 weeks, pregnancy showing periventricular hyperechogenic tissue, Note the clear delineation between the affected periventricular zone and the rest of the brain. Periventricular punctate hyperechogenesis consistent with vocal calcification. Parasagittal show lateral ventricle show presence of small temporal cyst, and this coronal image show temporal cyst. This is Cytomegalovirus infection, first trimester. Brain finding with fetal toxoplasmosis. Mild ventriculomegaly, multiple echogenesis into the cortex. Mild ventriculomegaly, multiple echogenesis into toxoplasmosis at 34 weeks. Postnatal echogenic confirmation, as we see. Coronal transvaginal scan at the level of the frontal wall of the lateral ventricle show multiple nodular echodensities. Multiple nodular echodensities. Wide open interhemispheric fissure. Right suspicions of developing brain atrophy. This coronal image show at the level of occipital wall show asymmetric ventriculomegaly. Asymmetric ventriculomegaly, this side larger ventricle than other sides. This is toxoplasmosis. Fetal varicella syndrome. Thorax واللung show echogenic spots. Retroperitoneum, right kidney hydronephrosis, bilectasis. في الابdomen we saw echogenic bowels with multiple papal aspect, vocal echodensities in the liver, a left-sided limb hypoplasia and club foot deformity. This is manifestation on ultrasound manifestation of fetal varicella syndrome. Hypoplastic left lower limb and club foot deformity, as we see in this right lower limb, left lower limb, hypoplastic left lower limb. As you see, this is images ultrasonographic to 32 weeks, multiple hyperechogenicities at the periphery of the fetal skull, the presentation of varicella skin scalp lesions. Panel A1C due to weighted show level of lateral ventricle at 32 weeks, hypoplasia of the right cerebellar hemispheres, as we see. Incomplete operculization of Sylvian fissures, as this image. This is panel, we see axial T2 images. We see hypoplasia of the right cerebellar hemisphere, and panel C in coronal T2, we see T2 at 37 weeks, intact firmness with hypoplasia of the right cerebellar hemisphere, hypoplasia right cerebellar hemisphere. It's visible as asymmetric butterfly sign. And this is the images, neonatal CT finding show right cerebellar hypoplasia, Fetal rubella syndrome, rubella. أول حاجة manifestations, we see IUGR, neuro, we see sensory neural hearing loss, microcephaly, meningoencephalitis, hypotonia, learning behavior autism. في الeye we see cataract, salt pepper, chorioretinitis and glaucoma, and see thrombocytopenia في blood, hemolytic anemia, purpura, and so on. في heart we show heart disease like peripheral pulmonary stenosis, aortic stenosis, trilogy of Fallot, PTA. في البون cellular stocking of long bone metaphysis. Other manifestation, interstitial pneumonia, myositis, hepatitis, hepatosplenomegaly, and thyroid disease. Ultrasound find rubella uterine infection, as we mentioned before, cardiovascular defect, pulmonary artery hypoplasia, coarctation of the aorta, microphthalmos, microcephaly, polycystic kidney, IUGR, hepatitis. This coronal view, fetal phase at 90 weeks gestation, microphthalmia and hyperechogenic lens. Microphthalmia and hyperechogenic lens is rubella syndrome. This coronal view at 19 weeks gestation show ophthalmic asymmetry and the microphthalmia, Congenital herpes simplex virus infection, CNS manifestation تتكلم with destruction of the following brain tissue, microcephaly, microphthalmia, chorioretinitis, hydranencephaly, multicystic encephalomalacia. This 3D hydrocephalus in patient with torch infections, as we see hydrocephalus. Congenital thrombosis of dural sinuses, as other abnormalities. Large fluid collection seen posterior to the brain corresponding to dilated superior-sagittal sinus, as you see in this image. Within greatly enlarged sinus thrombose seen as echogenic mass. This thrombus seen as echogenic mass with sinus. Color Doppler demonstrate causation of blood flow within a large portion of superior-sagittal sinus.